I'm doing a room scan, my patient room scan. And then I have my MAR, my drug card, and my provider orders. So I'm going to start. Hi, my name is Amber. I'm going to be your nursing student today. I'm going to close the curtain for privacy, use hand hygiene, and I will be using gloves for this procedure. I would use proper PPE when needed. Can I have you state your name and date of birth?
Joseph Smith, 10/5/54.
And your allergies?
Sulfa and betadine.
Okay, and checking the wristband, that looks good. Do you have any questions today?
Nope.
No? Okay. So I'm going to ask you a few questions. Are you comfortable?
Yes.
All right. And do you have any history of kidney disease?
No.
And have you been urinating okay?
Yep.
All right. So some assessments we have went over are we're monitoring vital signs, urine output, assessing for signs of fluid overload, regularly checking electrolyte levels, and we are keeping an eye on the IV site. So we're checking for infiltration, inflammation, phlebitis, and infection.
My bad.
Everything looks good. We're checking the date. It's 4/15. That is good. We're per Southwest Tech hospital policy, we are changing every 96 hours. So we're good with that. Everything looks good. I am going to go back to my med cart and get everything ready, and then I'll be back. Okay?
All right.
All right, so I'm going back to my med cart. You see me okay? All right, so I have my hospital orders and my MAR, and I'm going to compare. So I have Mr. Joseph Smith, 10/5/1954, 10/5/1954. 0.9% normal saline, 0.9% normal saline. Infuse 1000 ml. IV continuous for fluid balance. 1000 ml IV continuous infusion for fluid balance. Status is active, and this med has not yet been given. I will be giving it at 10:45 a.m. And my second medication is going to be the for Mr. Joseph Smith, 10/5/1954. Joseph Smith, 10/5/1954. My normal saline flush, 3 ml IVP PRN for IV patency. Normal saline flush, 3 ml IVP PRN for IV patency. Status is active. This med has not yet been given. I will be giving this medication at 10:45 a.m. I am going to my MAR away, not my MAR, put my provider order away. I have my MAR out, and I will be doing my first med check with my medications here. So I do have some used medications, so the packaging is open, but in the real world, I would have brand new packaging with no rips or tears or anything like that. I have, for my first med check, Mr. Joseph Smith, date of birth 10/5/1954. Joseph Smith, 10/5/1954. And this is my normal saline flush, 3 ml IVP PRN for IV patency. Normal saline flush, 10 ml. I will be only giving 3 ml IVP PRN for IV patency. Packaging is intact for this one. I have 10 ml. I will only be giving 3 ml. The no crystallization, no particulate matter, and the expiration is 12/24/26, so that is still okay to give. Then my second medication for Mr. Joseph Smith, date of birth 10/5/1954. Joseph Smith, 10/5/1954. 0.9% normal saline, 0.9% normal saline. 1000 ml IV continuous, 1000 ml IV continuous. Infusion, continuous infusion. Status is active, and this med has not yet been given. It will be given at 10:45 a.m. Packaging would normally be intact. I would make sure that it is new packaging, no rips or tears, and no crystallization or particulate matter in the medication. and the expiration date is January 26th. So that medication is okay. I have all of my, I have gotten all my supplies ready. My IV flush, my bag of IV fluid, my tubing, and then I have my gloves and my alcohol wipes also. And my border for my medication. So I have everything ready, and the amount of medication I will be giving for the normal saline is 100 ml per hour, 25 drops per minute. Again, that is 100 ml per hour, 25 drops per minute. So that is for my first med check. I'm going to continue to my second med check. So I have Mr. Joseph Smith, 10/5/1954. Joseph Smith, 10/5/1954. Normal saline flush, 3 ml. Normal saline flush, 10 ml. So I will only be giving 3 ml. IVP PRN for IV patency. IVP PRN for IV patency. The status is active, and this med has not yet been given. I will be giving it at 10:45 a.m. And packaging is good. Expiration is 12/24/26, and no particulate matter or crystallization. For my second med check and my second medication for Mr. Joseph Smith, date of birth 10/5/1954. Joseph Smith, date of birth 10/5/1954. 0.9% normal saline, 0.9% normal saline, 1,000 ml IV continuous infusion, 1,000 ml IV continuous infusion, 100 ml per hour, 25 drops per minute, and no crystallization. Integrity of the packaging would be good, no rips or tears. Expiration is January of 26. So I have my med check, my second med check done. Now I'm going to go back to the room for my third med check. And I also have checked labs before I got the medication ready. I've checked sodium, chloride, potassium, magnesium, BUN, creatinine, calcium, and all of my labs are in range. So I am okay to administer this medication. I'm going to go back to my room and get everything set up here. I also have my border. All right. Knock, knock, knock. Hi, my name is Amber. I am going to back to get your medication ready, your IV normal saline ready to put into your IV. Does that sound okay with you?
Mm-hmm.
Okay, I'm going to close the shade for privacy. I'm also going to provide hand hygiene, so I'll wash my hands. Do you have any questions?
Nope.
Okay, and then can I have you state your name and date of birth?
Joseph Smith, 10/5/54.
All right, and then do you have any allergies?
Sulfa and betadine.
Okay, so I am going to just check your wristband, and I'm going to scan your wristband in. All right, and it looks good. Scanning, just making sure we have the right patient. I am going to wear gloves for this procedure, and I would use proper PPE when needed. And I closed the curtain. Okay, I did all that. So I'm going to just go over a little bit of information with you real quick. Mechanism of action. Normal saline works by increasing the volume in your bloodstream, which helps to restore hydration and electrolyte balance. Adverse reactions, swelling, headache, nausea, confusion, hypertremia, and irritation at injection site. I'm going to have you teach this back to me. Do you have any questions right now?
No.
Okay. So I'll have you read over that a little bit just to make sure that you understand.
Normal saline works by increasing the volume in your bloodstream, which helps restore hydration and electrolyte balance. It can cause swelling in hands, feet, extreme drowsiness, high sodium levels, irritation at injection site.
All right, and do you understand all of this information?
Yes.
Okay, any questions? Are you comfortable?
Yep.
Okay. And I don't know if I said this or not, but this is not a high alert medication. If it was a high alert medication, I would have a second nurse double check everything. And now I will continue with my third med check. So I have Mr. Joseph Smith, 10/5/1954. Mr. Joseph Smith, 10/5/1954. I have my normal saline flush, 3 ml IVP PRN for IV patency. Normal saline flush, 10 ml, so I will only be giving 3 ml IVP PRN for IV patency. This status of this medication is active. It has not yet been given. It is 10:45 a.m. and I will be giving this medication now. Expiration is 12/24/26, and that medication is okay to be given. I will take this out. I'll not take it all the way out. I have it open and ready. No discoloration or crystallization. For my second med check, I have Mr. Joseph Smith, date of birth 10/5/1954, date of birth 10/5/1954 for Mr. Joseph Smith. 0.9% normal saline, 0.9% normal saline, 1,000 ml, 1,000 ml, IV continuous infusion, IV continuous infusion. And I will be giving 100 ml per hour, 25 drops per minute. And that is 12 to 13 drops per 30 seconds. I will get this medication out and ready here. And get everything else set up. And I'm going to put my gloves on. All right, so I'm gonna right away close my roller clamp on my tubing. Oh, let me get a little tangled up here. All right, so my roller clamp is closed. And I'm going to maintain sterility. I can't say that word. Keep sterile. Take this off, and I am going to put my tube into my bag all the way in, and then I'm going to hang my bag out, getting everything tangled up here. I don't know if I stated I have my barrier down also. My pole is going to be 3 feet above the injection site, or the IV site. Okay, and then I'm going to prime my tubing here. I got my boots up, both of them up, and it's going to be 1/2 to 2/3 full. Making sure I have all of my bubbles out, flicking the tubing if I need to. Okay, so close my clamp back up. And I'm hanging this up right now. All right, then I'm going to come back over here. I am going to take my flush. Make sure that I have all of the air bubbles out. Pulling it back. Okay. Air bubbles are out. Putting my cap back on. And then I'm going to scrub my hub for 30 seconds. That's funny. Somebody said that in class. Scrubbing the hub. Okay, 30 seconds. Here we go. And then while I'm doing this, I'm going to state that I will come back in 10 to 30 minutes to check for adverse reactions. If I notice any adverse reactions, I'm going to notify the prescriber, notify the pharmacist, discontinue all of the medications. I'm going to assess vital signs and document everything. And also notify, oh yeah, I said notify and document everything. Okay, so there's my 30 seconds. I'm going to take my IV flush, connect, opening the clamp here, and I'm going to use the push pause method and insert 3 ml. Actually, before I do that, I would pull back and check for any blood return, and then I would do the push pause method and put my 3 ml in. And when that is all in with the push pause method, I'm going to take this off. Actually, I'm going to clamp. Then I'm going to take this off and do my second 30-second scrub here. And while I do my 30-second scrub, I will say at the very end, I will make sure my patient has her call light. Bed is in low and locked position. Side rails are up. Table is in reach, and the room is clean and clear for risk of falls. So I have that, and then I'm also going to document everything. Upload my document in my MAR. Okay. So after I do that, I'm going to hook up my tubing without touching anything. Hook that up. And I want to make sure I have all my clamps open. So my clamps are all open so we can have everything run through. And then I will start my drip rate. And I don't think I'm going to be able to get my drip rate on here just because my tubing is not working. But I will state that I would leave this all open after I get my drip rate correct. And my drip rate is going to be, I'm having 100 ml per hour, 25 drops per minute. So I would have 12 to 13 drops for 30 seconds. And I did do this in class, so you stated that that was okay. So I would let everything run through. I'm going to clean up all my supplies. And I'm going to tape my tubing to my patient so that doesn't get tangled up. Then I have the date, time, and initials on my bag and my tubing. I have that.
What was dripping?
What is, oh my gosh, it's dripping. Okay, well, we'll let it drip. I don't know how it happens. Wish I would have. See if I can get it. 2 minutes. Try. Okay, so I'm gonna let that drip. Before I finish, I would clean up all my supplies, take off my gloves, and make sure I document everything, upload everything to Schoology. I did state that I would document the time and initials in my MAR. And I think that's everything. Do you want to bring that closer? I can see if I can have the drip rate right. We'll just try. Since I have time. Can you see it?
Mm-hmm.
It's gonna work right. No, I can't get it to. Oh, there it's dripping. Okay. Am I running out of time? Just about. I got 7. About 7. So I think I have stated everything. I'm gonna take off my gloves and I'm gonna use proper hand hygiene at the end after I clean everything up.